The Children's Lung Health team here at the Telethon Kids Institute started studying the long-term lung health of this group of preterm children over a decade ago. And what we found was that their lung health was actually declining between the ages of 4 and 12 years of age. So we looked at 200 children that were born very preterm, between 22 weeks, that was the earliest gestation, right up to the age of 32 weeks gestation. A lot of them weighed under 1 kilogram and probably would have fit into your hand when they were born.
They were a little bit early. They were born at 24 weeks at King Eddie's, and they were both around 700 grams. And were it not for the care that they got at King Eddie's, they certainly wouldn't be here. Back in 2011, when the boys were 8, we were approached to be part of a trial, part of a study, and they really enjoyed it. They've often asked about going back and doing it again.
It was actually really fun, like doing the treadmill exercise and the long tests.
We did a really comprehensive range of lung function tests over time, and that's the first time that this has actually been done. In addition, it's the first study to combine those kinds of things with imaging of the chest, so we use CT scans in this case. The key findings of this study are that between the ages of 4 and 12 years, kids that were born less than 32 weeks gestation are showing some level of decline in their lung function as a group, and that this is worse in those children that had bronchopulmonary dysplasia as babies. We also found that children who were exposed to cigarette smoke during their childhood had more declines in their lung function throughout that time. Our study also showed that there were particular children who had changes on their chest CT scan that suggest they might be having some ongoing active lung disease. And this is a really important finding because it might open up an avenue for us to be able to treat these children and stop the lung disease where it is.
The thing that I hoped for was, in being involved in the study, was that the boys would get a better sense of the things that have afflicted them. And if there was an outcome that meant that I could get a bit more of a sense of what was going to happen to the boys over time, that'd be great. Whatever we can do to contribute to that body of knowledge and to help other children, we're very happy to do.
So in the future it can babies don't have to go through a struggle, and the parents don't have to go through a big struggle, and the research can really help with that.
It's pretty exciting being part of it because we can help other kids, so in the future they can grow up, as he said, to grow up to be healthy.
There's currently very little follow-up for the lungs once a baby leaves the neonatal intensive care unit. Our findings suggest that the current approach might change by perhaps offering follow-ups in terms of respiratory follow-ups or lung health follow-ups. That offers us the opportunity to intervene earlier to make sure that these kids grow up with healthier lungs. It's really important to remember that the studies that we find as a general population don't apply to all children. In fact, there were quite a number of children in our study who were born very preterm who went on to live very active athletic lives, and some who are even now competing at a state level in school sports.
I expected that there would be health issues, and I expected that there would be lung problems. Now that they're 10 years on from their last hospital admission for lung function issues, they're pretty healthy kids. They both play lacrosse, they both surf, they skate. Given where they started, it's pretty remarkable.